I fell off a ladder 3 feet and projected my leg into a wall. So I shattered the two bottom legs and two bottom bones and put them through my knee. So I was a mess. It was 3 months with no pressure on the leg at all. So it took me a good 6 months to get back to work and everything. And then I worked for a couple of years, and the leg was really bothering me, the knee. And that's when I came back down to 100 Orthopedic and talked to Dr. Pollock and asked him if he would do it. And he, at that point, I think it was the springtime, suggested I wait until the new doctor that was coming, who had very good credentials. And I waited for Dr. Glassner, and first time I met him, I was very, very impressed. He did it in 2 surgeries. The first one was just to remove all the metal that was in my leg, because they had a plate that was holding my bone together, and I had all the screws and everything. So we had to remove all of that, because the screws were into my knee, so there was no way they could, replace the knee with the metal and screws in the way. So that was the first surgery. And then, I was trying to think, it was 5-6 months later is when I had the knee replacement. And by that time, my leg kind of caved in. And so by the time the second surgery came along, between my leg crooked and arthritis, I was in pretty bad shape. He did the surgery, and I'd asked him how long. He said a normal knee, 2.5 hours. Your problem, 4. Well, I found out afterwards it was 6, because he put the one knee in and could not get my leg straight. So I had to take that out and put a second knee in order to straighten the knee. And the next day I was up and walking. He did his job, and he did it beautiful. Well, for once I didn't have pain, which was a blessing with the arthritis. And then when I was able to get up and walk, and I was a little hesitant about putting the pressure on the leg the first time, but the physical therapists at the hospital were great. And they said, no, you can do it. And it was great. And then a couple days later, I went over to the rehab, and they wanted to give me all kinds of medication for pain. And I said, oh, don't need it. Oh, you're one of those tough ones that doesn't need. I said, no. Believe me, if I needed it, I would take it. But I said, just a little Tylenol, go into therapy. And after that, I didn't have any pain. It was like it never happened.